Good afternoon, everyone, and welcome to the City of Deltona's press conference for an update on the COVID-19 virus and what the city and our neighbors and partners are doing for the residents and the rest of our community. First of all, I'm Mayor Heidi Hertzberg, and I'd like to let you know who is all here today as well. We have Interim City Manager, Dr. Mark Anthony Cooper. We have our Fire Chief and Emergency Manager, Chief Snyder. We have Volusia County School Board District 5 Representative Ruben Colon. We have Rafael Ramirez, Administrator of the Medical Center of Deltona. We have a statement from Advent Health, and we have Sheriff Chitwood. We also have today Captain Marino from the Sheriff's Department and Vice Mayor Ramos. So I will begin. As of this morning, the state of Florida has a total of 360 cases of COVID-19 that are positive. Volusia County has 9. The best website that you can access all the information, including every single case, if it was travel related or not, the number of positives, the number of tested, the number of negatives, is floridadisaster.org. Access that website and you will be able to get all the information for the entire state of Florida regarding all the cases. Once again, it's floridadisaster.org. So to talk about some things that the City of Deltona is doing, first of all, concerning City Hall operations are open, but access by the public in some aspects have been limited. We recommend homeowners and businesses looking for information or permitting submit information via our online portal at the City of Deltona's websites under permits and register. The regular City Commission workshop scheduled for March 23rd, 2020 has been canceled. The regular City Commission meeting scheduled for April 6th, 2020 will be evaluated prior to posting for cancellations or restrictions or rescheduling. Any regularly scheduled advisory boards and meetings will be rescheduled to later dates. The Center at Deltona. In an abundance of caution, the Center at Deltona has postponed and/or canceled non-essential events, community gatherings, and engagements involving more than 10 people at the city-owned facility. Staff is contacting clients and working to reschedule as many events as possible and/or issuing refunds. Parks and Rec. This has been a lot of questions across the county about what our cities doing regarding parks. The Park and Rec Department located in City Hall will be closed to the public until further notice in order to reduce staff's exposure. City parks are still open to the public, but amenities as the gymnasium, splash pads, etc. are closed, and we highly recommend residents adhere to limiting gatherings to no more than 10 people and adhere to the recommended social distancing guidelines of 6 feet or more. Deposits for reservations have been or can be refunded. Deltona Water. Deltona Water will be turning on all customers who had been shut off due to non-payment. Disconnections due to non-payment have been suspended for the next 30 days and will be re-evaluated at that time. However, any penalties incurred for late payments will be added to the customer's outstanding balance. Another question we've received is regarding small businesses and small business assistance. I'm going to give you a couple of websites. One resource from the state of Florida is the Florida Small Business Emergency Bridge Loan Program. That website is, again, floridadisasterloan.org, floridadisasterloan.org. The state of Florida utilizes its business damage assessment survey to determine the level of impact and the need for federal and state disaster assistance. If your business has been impacted by the virus, it is imperative that you complete this important survey at floridadisaster.biz, B-I-Z, floridadisaster.biz. And there's also a resource from the federal government for the U.S. Small Business Administration. They have activated its Small Business Association Economic Injury Disaster Loan Program. And that website is disasterloan.sba.gov/ELA. disasterloan.sba.gov/ELA. There's also reemployment assistance, and that website is floridajobs.org/job-seekers-community-services. All of these websites and the links will be available on our website. Now I'd like to address a couple non-city related issues from some of our partners. First of all, there have been questions out there about the humane societies. Are they open? Are they taking animals? Speaking with Halifax Humane Society, you can also go on their Facebook page to access all their information. As of today, Halifax Humane Society remains open. There also, contrary to some rumors, has been no uptick in admissions of animals. What that means is people are not surrendering their animals due to the virus. I know that's been out there, and maybe there have been several cases across the county at private vets or across the country, but that is not the case at Halifax Humane Society. What Halifax Humane Society is asking for are fosters. While you're in isolation or in quarantine or sequestered at home, Halifax Humane Society is asking that you open your heart to maybe foster some of the animals that are in the Humane Society because they are at close to or at capacity. We also ask from Halifax Humane Society, they ask that if you don't have to surrender a pet at this time, please don't. And please don't bring in any unnecessary animals. Halifax Humane Society has taken very, very many precautions regarding safety for its employees and people going into the Humane Society. They are requesting that should you want to foster or adopt, please make an appointment for a one-on-one meeting in a room that has been sanitized prior and after meetings. So once again, to reiterate, the Halifax Humane Society is still open, and please, if you have it in your heart to foster an animal, please do that. Just a couple more items concerning our seniors. We all know that there are some seniors out there that don't have access to the internet. They don't have a computer. They may not know how to use that. So what can you do to help? We have several things that you can do to help. You can pick up a meal or two to drop off. You can reach out to anyone that's elderly that you know that might be isolated. You can offer to bring an elderly person supplies or medicine. You can bring them basic food and other necessities that could be needed. We also have a flyer from the city of Deltona that it's on our website, and it also has the information for the numbers for the Department of Health should seniors feel the need to be tested or they're worried about their health. The first thing they should do is contact their primary care physician, but if they really have concerns, they can also call the Department of Health. So next up, what I would like to do is introduce our Volusia County School Board representative, Mr. Ruben Colon, to address the school board issues.
Good morning. First of all, I'd like to thank our families for their patience during these really uncertain times. Just like you, the ever-changing nature of this pandemic has required constant adjustments to the response and the plans moving forward. But one thing has not changed. We are committed to the education of our students. Everyone is aware that the Governor and Commissioner of Education have extended the spring break holiday until March 30th, 2020. Subsequently, they ordered all Florida public schools to remain closed until April 15th, 2020. As a result, all classes and extracurricular activities were suspended until further notice. All remaining assessments for school readiness, voluntary pre-kindergarten, and K-12 assessments are canceled for the 2019-2020 school year. Requirements for graduation and promotion and final course grades will be evaluated as though those assessments which were canceled did not exist. In other words, the students' current grades, in addition to those obtained during the remainder of the school year, will be used to determine promotion. K-12 school grades will not be calculated to avoid disruption to school leadership and operations. When we talk about school grades, we're not talking about students' grades. We're talking about the grades that the state issues each school based on those assessments. Additional information regarding Bright Future Scholarship is forthcoming. We are still awaiting answers for assessments regarding accelerated courses, IB, ACE, and industry certifications. In order to continue to support our students nutritionally, we're providing meals to students at 27 designated sites across the county. Those sites will be serving meals between 10 a.m. and 12:30 p.m. In Deltona, those sites include Galaxy Middle School, Spirit Elementary, Pride Elementary, Deltona Middle School, Osteen Elementary, and Volusia Pines. We will likely be extending those dates and adding more locations. We will utilize a drive-in procedure through the bus loops to minimize person-to-person contact. Preparations are in place for remote and digital learning for all schools. This at-home learning is expected to begin on March 30th after the spring break holiday. Remote learning will be delivered in various formats: online, videos, printed packets, as well as some other very innovative methods. In the coming week, our teachers will be returning remotely to train on the delivery of remote instruction. It is during this time they will prepare the delivery and the materials for their students. Ensuring that your information is correct on the parent portal is essential. Please make sure we have your correct phone number, that we have your correct email so that we can get that information to you. Again, remote instruction will begin on March 30th after the extended spring break holiday. Many families of our seniors are asking, how about special events such as prom, graduations? We are still seeking guidance from the state on those events. As far as VPK and early learning programs are concerned, all VPK and early learning programs that are housed in our Volusia County schools will remain closed until all students return. Remote learning opportunities will also be afforded to these students as part of our distance learning implementation. A lot of folks have asked me about community VPK programs. According to the Early Learning Coalition, each child care program will make the decision on whether or not to close. Again, this only relates to community VPK programs. So I would encourage you to visit the Early Learning Coalition of Flagler and Volusia County to get more information on those programs. Volusia County Schools is committed to the education of our students during this challenging time. Through the combined efforts of students, parents, teachers, administrators, and support staff, we will continue to NA the Volusia way. Thank you.
Thank you very much, Ruben. Now I'd like to read a statement from Advent Health. So Advent Health has provided this statement for us. Unfortunately, they could not send a representative today. So they want you to know that tests are limited and require a physician's order. Physicians will order a test only for those who meet testing criteria as defined by the Centers for Disease Control and Prevention. There are no community drive-up, drive-through sites currently at Advent Health. If you are feeling ill and you think you may have been exposed to the virus or may have it, first thing that you should do is contact your primary care physician, who will then determine whether or not you can be tested. Because of the limited supplies and resources, the test will only be facilitated with a physician's order for patients who meet the evaluation criteria as defined by the Centers for Disease Control and Prevention. Basically, that is the standard for Advent Health and for the testing procedure through them. And we'd like to thank them very, very much for being a community partner and sending that information. And now I would like to introduce Mr. Rafael Ramirez with the Medical Center of Deltona.
Thank you, Mayor. My name is Rafael Ramirez, and I am the administrator of the Halifax Health, UF Health Medical Center of Deltona. And I would like to cover a few of the plans and preparedness that we have to date at our system. And by the way, we are ready for COVID-19, so be assured of that. First, our role is to remain open and ready to care for the most ill in our community. Second, our preparedness for we are prepared for a significant increase in the number of patients requiring hospital services if COVID-19 begins spreading in our community, and certainly we're hoping for it not to. Our 3 hospitals have been designed and built to accommodate surges in patient population, virtually allowing us to double up our bed capacity. Our commitment to our mission remains steady, and that is to be there for all the people in our community 24 hours a day, 7 days a week. Our 4,300 team members are prepared to once again serve our community in a time of crisis. We hope for the best, but we're prepared for the worst, and we stand ready and beside you to endure this pandemic. In addition to an exceptional staff of highly skilled nurses, we have expert physicians on our medical staff representing 54 subspecialties throughout the hospital system and serving our community as the area's only level 2 trauma center. We're also fortunate at Halifax Health Systems to have a full-time in-house infection control specialist and epidemiologists who are working nonstop to help us understand, communicate, and prepare for the latest developments. In order to maintain the safest environment for our team members, patients, and visitors, and to plan for increased demand, we set up emergency services stands and separate screening areas at all of our hospitals. These will facilitate quicker and safer screening of patients who present with possible COVID-19 symptoms. We need to be clear, we are not screening patients without symptoms. A person who is tested will have specimens taken, and these samples will be then given to the county health department, who will then either ship or deliver them to the closest state lab. If a specimen is tested positive, it will then be identified as a presumptive positive until the result is confirmed by the Center for Disease Control and Prevention, the CDC. This can be a three-day or longer process. During this time, we advise that you should remain in self-isolation and care for yourself as if you have the flu. We continue to see between 350 and 400 patients every day through our 3 emergency departments. So far, we have identified approximately 40 patients as of yesterday that are appropriate candidate for COVID-19 testing. We have not had a positive result at Halifax Health or its system hospitals yet. Patients with fever and respiratory infection symptoms are placed in isolation for the protection of the staff and other patients. They're seen and evaluated by a qualified medical provider, and appropriate treatment is provided. Anyone entering an isolation room will wear personal protective equipment that includes gloves, gowns, respiratory protection, and eye protection. For our inpatient populations, visitor restrictions are in place. Only non-symptomatic partners, immediate family over 12 years of age, and healthcare surrogates may access Halifax Health locations with a limit of 2 visitors per patient. All visitors will be screened for symptoms of the flu and possible COVID-19. Anyone with flu-like symptoms will not be allowed access. Our staff is continually trained and educated every single day on the care of all of our patients. With COVID-19, additional training and education is being conducted. Lastly, we're making every effort to educate and inform the public on the ways to remain healthy, including rigorous and frequent hand washing through our website, halifaxhealth.org, and our social media outlets. So please check these for further information. Thank you, Mayor.
Thank you, sir. And now if our interim city manager, Dr. Mark Anthony Cooper, can come up and address a couple issues.
Thank you, Madam Mayor. On Monday, March 16, 2020, the city of Deltona followed in suit with the Volusia County and declared a state of emergency in the city. With that state of emergency came several actions that we took at that period of time. With our building inspections unit, we limited social interaction and we limited personal contact with residents during building inspections. However, building inspections are still occurring. The social distancing guidelines and regulations are being followed with our building inspectors, and if they are uncomfortable in the situation, they will reschedule that for a later date. Our code enforcement has been directed to limit social responses to social interactions with direct public. They are responding to emergency situations. They will be limiting direct contact with individuals, and if they do, again, social distancing is highly encouraged with them. In part with the response to COVID-19 outbreak, the city managers all over Volusia County, in cooperation with the Volusia County Sheriff's Department, who's been a great partner in this, we are all speaking and helping each other. We are on a conference call 3 days a week where we are discussing different responses. We are discussing how we can help and how to better provide for our communities and our residents. City Hall, as the mayor stated, is open for business. However, we're working hard to ensure the safety of our staff, and we're following protocols and limiting interactions as much as possible with our staff. But City Hall still remains open. So for any information that you would like, please visit our website, deltonafl.gov. We are consistently updating that website. And for specific questions on COVID-19, you can actually direct those questions to the Florida Department of Health, and their call center is open 24/7. That number is 866-779-6121, or you can email them at covid-19@floridahealth.gov. Thank you.
Thank you, Dr. Cooper. And now I'd like to have Chief Snyder, if you'd like to come up and update us a little bit on the emergency responses.
Thank you, Mayor. As Dr. Cooper said, we are, as information comes available, we are trying to put that information out on our city websites. We are monitoring both our county and our state partners on a daily basis to get that information. When we do get that information, we put it out as quickly as possible on all our websites, and we're also sending that information out via email to those that are signed up to receive emails from the city. As for the fire department, again, we continue to monitor the information from our county and state partners, and we are also monitoring updates from our county medical director to look out for changes for our medical protocol. When you call 911, a dispatcher will not only ask you relevant questions as to what you called for, but also ask specific questions recommended by the CDC and the Florida Department of Health as it relates to COVID-19. This information is then passed on to our responding crews to help us provide a safe and effective service. Our paramedics and EMTs will respond to all medical calls wearing masks, gloves, and protective eyewear. Again, this is to protect the citizens and crews from any potential exposures. If the call involves a patient that meets CDC criteria for COVID-19 patients, our paramedics and EMTs will then wear masks, protective eyewear, gloves, and gowns, again, to minimize that risk of exposure to both our crews and to the patients. To ensure that our personnel are healthy and able to provide the highest quality of service to our community, we are performing baseline health checks on all on-duty personnel, both at the beginning of their shift and in the middle of every 24-hour shift. In addition to normal hand washing and decontamination practices, all Deltona Fire Rescue stations, fire apparatus, and transport units are being decontaminated regularly using an automated autoclave decontamination system, which uses a penetrating disinfectant fog to completely clean in all surfaces within the vehicles and the stations. We ask you as the community to continue to follow recommended CDC guidelines. Hand washing for 20 seconds. Cover your mouth when you cough or sneeze. Social distancing. Do not touch your eyes, nose, or mouth, as well as staying home when you feel sick will help to control the spread of COVID-19. Again, I'd just like to reiterate the hotline that Dr. Cooper put out. If you have any questions or concerns, we recommend that you call the Department of Health's hotline at 866-779-6121. Again, that's 866-779-6121. And with that, I'd just like to thank you. Anna?
Thank you, Chief Snyder. And now we'd like to welcome Sheriff Chitwood for his update.
Thank you, Madam Mayor. As we all know, we are living in unprecedented times, and it takes unconventional solutions to all get together to get through this. When we all got up this morning, we are one day closer to putting this event behind us. As far as the Sheriff's Office is concerned, here in Deltona and through the rest of the county, with the closure of schools and the closure of the courthouse, we are fully staffed. What we're asking the public to do is, in non-emergency situations, we're going to ask you to either fill out a police report online or come to one of our district offices and fill out the report in person there. The objective is our version of social distancing. And to follow up on what the fire chief said, when you call 911 for a medical emergency, be prepared to be screened by the call taker. In some cases, you may get transferred to a triage nurse. Volusia County started a great program several months back where we actually have nurses in the dispatch center that can help walk you through your symptoms to get the correct help that you're looking for. And lastly, I want to ensure this county, as I make my way through the county and I'm flying at 30,000 feet and seeing what's going on throughout the different cities here, we are in great hands. Advent Health, Halifax Hospital, and our Volusia County Board of Health, or Health Department, have been absolutely outstanding. And I can't stress that enough. They are prepared to deal with this unprecedented crisis. They are true professionals. The same applies with our first responders. We are blessed here in Volusia County to have first-rate fire departments, EMS, and police departments in the Sheriff's Office. And I asked you to help us protect them. Give us all the information. Don't hide anything back. Self-isolate. Because remember, if the first responders become ill, we're no longer first responders. So God bless everybody and stay safe, and God bless America. We'll get through this.
Thank you very much, Sheriff. To conclude, does anyone in the media, do you have any questions that you would like to ask for any of our representatives that were up here today?
What kind of impact is this going to have on city commission business? I mean, you guys have meetings every Monday, typically, whether it's a regular commission meeting or a workshop. And now there's a lot of uncertainty as to when we'll be able to do these again.
Well, basically, I mean, we're not the only city in that boat. We had also, in addition to the managers having calls, the Volusia mayors had a conference call this morning organized by Mayor Burnett in Port Orange through the Volusia League of Cities, and we discussed that. That was one item that was discussed, and from what I understand, the state is also looking at, as you know, we have protocols that we have to have for meetings. You have public comment, you have sunshine law, and so forth, and there, Governor DeSantis is looking at some protocols for that should this continue, where municipalities are not able to hold meetings without adhering to the social distancing. And how do you say, you know, here you have 50 people come in here, you can only have a group of 10. You can, in our chambers, it's big enough to go ahead and spread people out, but not every city has that luxury. And, you know, you have a lot of public input that is technically required. And you also have to deal with the fact that you have topics that are timely that have to be done. For example, our state of emergency, we did that Monday night. It lasts 7 days, and the manager and the fire chief have the option to do that recurring for the next 3 more times, right? So in another month, one way or another, we have to meet again. if this continues. So do you meet remotely? One of the cities on the call this morning said that they put in some protocol that they're able to meet remotely if one or two of their council members or commissioners are not able to do that. That's one option. Another option is you just have a closed meeting. All that has to come basically from the governor and what kind of protocol we're going to be allowed to do. Should there be anything pressing, like a state of emergency, if we have to have a meeting, we would have that meeting for something like that. Most of our other business, and I would defer to Dr. Cooper on that, is something that is not going to be dire to be postponed 1 or 2 meetings down the road. Should something come up, we'll have to address that and look at the protocols that the state brings forth, because it's not only for the safety of the commission, it's for the safety of staff, because as you know, when you have a commission meeting, your staff has to be here, right? And you have the public. So all these things are very fluid and will have to be addressed, hopefully from the state on down, as to whether or not they're going to allow the municipalities to change any of their protocols. Any other questions?
Yes, Mayor. I guess the Volusia County itself was only has 9 positive tests right now, right? You know, as mayor of the biggest city in Volusia County, are you satisfied with the current testing protocols? I mean, do you think that that is going to be enough?
Well, as on a personal note, for the citizens of Volusia County, 90,000 plus people, and you look at 9 positive cases, those are basically all travel related. If you look on that website, it breaks it all down for you. It looks, for now, that we're in good shape. However, there's the whole underlying spread. We have a lot of visitors here. We just had Bike Week. We have people at the beaches. So the protocol for testing is very, very strict. You know, when you, and I don't know if the sheriff didn't address this, but possibly doing some drive-up testing down the road through the hospitals and through possibly the fairgrounds and so forth, the criteria issued by the CDC, and that's what we have to go with, is very, very strict. I believe that at some point that criteria is going to have to be relaxed when more testing kits become available, because we all maybe are happy that there are only 9 cases right now, but I don't buy that that's all there is. So at some point, if you start looking at the curve and you look at some of those statistics, you can see that a very, very large number of people are testing throughout the state, are testing younger and younger. There was a 6-year-old in Palm Beach County yesterday that tested positive. So you're not only looking at seniors, you're looking at that whole group of people that are possibly contagious, don't feel symptoms, feel something mild, and are passing that on to our most vulnerable residents. So at some point, I'm hopeful that as more tests become available, there'll be less strict criteria for testing across the board, not only for Deltona or Volusia County.
And I just had one other question for the sheriff, if that's okay.
Yes, sir.
Sheriff, last week you expressed a lot of concern. Sorry, I'm just moving this up. Last week you expressed a lot of concern about the communication between the state and not only you but first responders all over the counties. Do you feel that communication has improved, and are you satisfied with how things are going to move forward?
It absolutely has gotten better. I was on a conference call Friday or Tuesday with all of the other sheriffs, all 67 sheriffs in the state, and everyone who ran a communication center was getting the information about the addresses where coronavirus or somebody who was quarantined was, so that we can then flag that address and make sure that when fire, EMS, or law enforcement goes, they know how they need to respond. So the answer to your question is yes, I think the flow of information is getting better, and I think that that's one of the things that all of our residents want. They don't want to live in this uncertainty area. They want information, good, concrete information. And right now, as you see from Halifax Hospital and Advent Health and the Department of Health in Volusia County, you're starting to see more and more of that information coming out. I mean, I think it was great that Halifax talked about they did 40 tests for presumptive coronavirus, and they all came back negative. That's a great sign for us.
One of the questions that I was asked prior to holding this press conference was concerning supplies for not only first responders with, I think Chief Snyder, you addressed that, but for our hospitals, because you're seeing things and you're hearing a lot of commentary that our nurses, our doctors, our people that are working in hospitals don't have the proper PPEs or they don't have enough. So Raphael, can you address that?
Sure, Mayor, thank you. So first of all, I want to be very reassuring, as I am sure our brothers and sisters from Advent are. We want to be reassuring that we have an adequate amount of supplies. We at Halifax, on our system, we have 2 conference calls every day to plan and discuss any issues or any preparedness plans or changes in the coronavirus issue. And one of those is the discussion on our supplies, especially dealing with the protective gear. And while we are very cautious, we are very protective, but we are prepared and we have the necessary gear to protect the patients, the staff, the families, and whoever comes in. Cautiously prepared also means that, unfortunately, we don't have boxes of masks and things just to give out in public. Clearly, our business is of saving and healing, and so we have to be protective of that gear. So, but as a system, as a community, I think our 2 main hospitals are certainly adequately supplied.
Any more questions? Yes.
We've seen a lot of the grocery stores kind of stripped bare of certain things. For people who haven't been able to adequately prepare for this, and people who can't necessarily leave their homes to get those things that they need, is there anything, and maybe this has come up in some of the conference calls, but for residents who might need help, is there something that Deltona or the county or the cities can do as far as, collecting donations of things that, are now hard to find in the stores?
I have not heard anything like that on our mayor's conference calls. I don't believe you've heard anything either on the manager's conference calls. We received an email yesterday from United Way. 211 is up and operational. People are able to call through that. And that kind of, your question, Katie, brings me to something else I was going to say, and that is, excuse me, the use of social media. We see a lot on our different platforms, whether it be Nextdoor, Facebook, Twitter, Instagram, about helping one another. We have a great group in Deltona called Neighbors Helping Neighbors. And other cities have those kind of groups as well. And what you really want to do is reach out to those type of groups, and those groups will help. I see it all the time. And there's something also on our website that I mentioned before. It's a flyer. I'd like to update that and just have on that flyer the number that we have, the website for the health department, but I'd also like to include the number. If you want to print something like that out and hand that out to the people that maybe need that help also. Well, the one thing that we've seen just in the business community is the amount of people that are reaching out to other people. And this is a time maybe not to socialize with your neighbors or to get too close, but to know who lives in your community and how you can help them. And the city of Deltona, even if you give us a call, there's many people in the city, in our planning department, our housing department, that have access to how the city can help or how their other resources are for the county. There's still the assistance that's always been there. The churches still have some food banks going on, and those are great resources. The other thing I just saw today, that it's Publix, and I believe Target and the dollar stores are doing senior shopping hours first thing in the morning for those people that are really at risk. And you also always have the home delivery options. So I think that as we reach out to our community, as we reach out to our neighbors, I would also ask, our first responders, our fire department, our sheriff's department, they are out there and they see the needs in the community. And if they see the needs of elderly people or of people that are disabled or can't get out and need that help, reach out to me, reach out to the groups in our city, and let us know how we can get together and help, because this is far from over. And like the sheriff said, every day that we wake up, it's another day closer to getting this over with, but it's still, we have a long road ahead of us. And just to conclude, do you have any more questions? Just to conclude, someone sent me this, and it's like front porch, and it came from Farmington, Michigan, but it's, every night at 7 p.m., step out of your home to wave to your neighbors, visually check in with each other, share supplies, chat across driveways, and generally provide comfort and human interaction safely. And that's something maybe we can think of on a small scale. Wave to your neighbors, wave to those people that live around you, talk to your coworkers, ask them if they need anything. There are plenty of people that don't have access to childcare right now. And it's hard because kids are out of school. We are a great community. I always believe in the greater good of everyone, and I firmly believe we'll get through this positively, and I think in the long run, we'll all be better because of it. And I want to thank everyone that was here today. Thank the city staff, Dr. Cooper, for setting this up, our fire chief, Sheriff Chitwood, Captain Marino, everyone that was here, our hospitals. Thank you, Advent, for sending out a statement for us, and our school board as well, because I think it's important that Mr. Colon came in and talked about a lot of the pressing issues that we need regarding our schools. Also, if you have any questions, please feel free to email the city, and we will keep this set up here. Should we have another press conference, as things are changing, we'll be looking at doing these more often. Thank you very much.
Thank you, ma'am.